Can you hear me okay? We'll get started in just about 2 minutes.
Okay. Hi, everyone. Welcome. Hi, Deb. How are you doing?
Hi, Sarah. Great. Good to see you. Good to see everyone coming in.
So I can't hear you, Deb. It might just be my audio. Hopefully it'll come on in just a second. I know it can take a moment. Can everyone hear me okay? Yep. Okay, perfect. Okay, we'll go ahead and get started. So thanks so much for joining us, everyone. My name is Sarah, and I work in admissions here at SCNM. So we're so glad that you could join us. For those of you who are joining us for the first time, these virtual discovery chats are something that we do every couple of weeks or so to give you more information about our naturopathic medicine program and all that we have to offer at SCNM. And often we have special guests joining us, whether it's current students or alumni. And today we do have a special guest. One of our current students will be joining us. Her name is Christiana, and I'm happy to introduce her. But before I do, I want to give a little disclaimer. So today's chat might be a little bit shorter than usual. Unfortunately, Christiana had a vet emergency this afternoon. She is currently at the veterinarian with her animal companion, but she offered to still do this chat as long as she could. But if for some reason, if she does need to leave a little bit early, then my colleague, Deborah, who is also on the chat with me, and I are happy to answer any questions that you have about the program, about the admissions process, anything like that. But I just want Christiana to know that she, not to hesitate to leave if she needs to. Christiana, is that you? Are you here?
Yes, hi.
Okay, I see the name is different, so I just wanted to.
Oh, is it? I'm sorry. I'm on my phone, that's why.
Oh,
yeah, I'm in the room right now, so I'm assuming the vet will probably come in soon. And I'll just mute myself for like less than 5 minutes probably while she comes in. But okay, we can continue. I'm sorry, everybody.
Oh, no, not at all. I mean, I know many of us, myself included, have animal companions, so we totally understand, and we want you to do what you need to do. So again, if you need to leave early, just don't hesitate to let us know, and we'll just take it from there. So thank you, everyone, for understanding. But yeah, so Christiana, I'm going to start by asking you just a couple questions to get the ball rolling, and then we'll open it up to the rest of our attendees. You can ask your question in the chat, and I'll go ahead and ask Christiana for you. So can you start by telling us a little bit about how you found out about naturopathic medicine and why you chose SCNM?
Yes, so when I was in high school, I got really interested in nutrition, and I thought I wanted to be a registered dietitian, like that was my end goal. So I went to college and majored in nutritional biochem, and eventually I thought I was going to be a dietitian. Then in college, I worked at a local hospital, like working under a dietitian, basically. I was like her assistant. And then I realized that is not what I wanted to do at all, because they have like very little control over what they actually do with their patients. I know that definitely matters, like where you work and all that kind of stuff, but ultimately I wanted to have more of like a say of how I treat my patients and stuff. But I didn't want to go the conventional medical route because my parents are both doctors, and they're not fans of how the pharmaceutical industry basically does most of everything for them. So I found out about naturopathic medicine after just researching on the internet about what I wanted to do. And then I applied to SCNM and Bridgeport, which is now not a school anymore. And so I ended up here.
Well, great. Well, yeah, we're so glad to have you with us. And Yeah, so I'll ask just another kind of two-part question, and then we can open it up to the attendees here in the chat. So can you tell us one of your favorite aspects of being a naturopathic medicine student, and then maybe one or two things that students need to be successful in the program?
Yes. Hi. Hi. The vet is here. I will resume in 1 minute.
Okay,
Thank
sounds
you.
good. Not a problem. Okay, so while she is doing that, feel free to let us know if you have any questions about the program itself. I will go ahead and start by talking about the requirements. So we do require that all incoming students have a bachelor's degree, as well as, and it can be in anything, you know, it doesn't have to be pre-med or health science related, as long as you have the science prerequisites. So we do require several courses in biology and chemistry. Courses like anatomy, physiology, organic chemistry, biochemistry. Those are just a few examples. Now, say you graduated a few years ago and you have a degree in business or the liberal arts and you haven't taken those science courses, then you can just take them at your local community college or online and then apply to our program. And if you're interested, Deb, would you mind writing my email address in the chat? We would be happy to do a transcript pre-evaluation for you and let you know exactly what additional courses you'll need and what your next steps are. If you want to email me a copy of your unofficial transcripts, we can let you know what courses you'll need. So, any questions about any of that so far? Okay. And also, just to clarify, it is a 4-year full-time program here in Arizona. So we're in Tempe, which is part of the Phoenix metro area. It's where Arizona State University is. It's a vibrant college town, lots to do, but it is an in-person program. And, you know, once students graduate and they pass board examinations and they become a licensed naturopathic doctor, a lot of them end up staying here in Arizona because we're pretty lucky in that Arizona has probably the widest scope of practice for naturopathic doctors in the country. So there's really a lot they can do here. It also allows our program to be really comprehensive. So for example, we include acupuncture and Chinese medicine within the ND program. You don't have to do a separate program to learn that. We also include IV therapy, minor surgery, physical medicine, environmental medicine, of course, nutrition and herbal medicine. So we are very lucky in that regard. While we're waiting, Deb, do you want to introduce yourself and feel free to add anything that I may have missed?
Absolutely. Well, we're also glad that you're here. And my name's Deborah Moore. I've worked in admissions at SCNM for 10 years and absolutely love it. It's so amazing to meet prospective naturopathic medical students and then see them become students and then see them become NDs. The one thing that I would add to Sarah's list of what you can do in your scope of practice here in Arizona is regenerative medicine. And, you know, managing pain and getting people off opioids and other addictive pain medications. It's such an amazing thing. And we're the only school, the only ND program that offers regenerative medicine. So that's very exciting. And if you do have basic questions that you would like answered and you want to type them in the chat, that's fine. You can also type your questions for Christiana in the chat. And if we run out of time, if she has to do something with her fur baby and we run out of time, we can send those questions on to her and she can answer you via email at a later date.
Yes, absolutely. Thanks, Deb, for mentioning that. So yeah, if we're not able to chat with Christiana very much, then you can write your questions in the chat. We'll take note of them. And once things settle down, we'll be able to send out an email to you with her answers. So hopefully that will be a substitute for now. I do see though that we have a question. During our last discussion, we touched on those who went on to pursue residencies. Do students typically remain in Arizona for those? Or if they leave, what are they typically trying to pursue in a residency program? So yeah, so unlike conventional medical schools, a residency isn't required, but it is an option. So I'd say at least 20% of our students go on to do a residency. And yeah, many of them do stay in Arizona. We actually have several residencies available at our campus because we have 2 medical centers on campus. Our first medical center has been around, of course, for many years, and that's where we see patients with all sorts of chronic conditions. Our newer medical center, as Deb was just mentioning, focuses on regenerative medicine. So we're doing things like prolotherapy, platelet-rich plasma therapy, these natural injection therapies. We also have a cryotherapy chamber, popular among athletes and people with sports injuries. So if you have an interest in regenerative medicine or pain management or sports therapy, then you can not only have clinic rotations in that medical center as a student, but then you can apply for a residency after you graduate. You can do residencies at local ND clinics here in town or in a different state. So there's lots of options for residencies. But I hope that answers the question for now. I do see that Christiana is back, so we'll go ahead. Is everything okay?
Yes, here he is, if everyone wants to see him. She thinks he might have pancreatitis, so we'll see.
Oh, okay. Well, thank you for sharing.
He'll
It's
be
nice
fine,
to see him.
Okay, so the question was what I like being about a ND student.
Yeah, we'll start with that, yes.
Okay. I honestly like all the modalities that we get to learn because we get to learn Western medicine, like pharmacology. And in the clinic, I've seen most patients are on some sort of medication. So it's really important to know how all of the medications work and how to work with them. And I like how all of the doctors who teach us in the clinic are very supportive of all the patients using medications if they need to. And so we never try to like get them off of their medication. We always try to help support whatever their body needs. I also like learning about all the acupuncture, botanical medicine, homeopathy stuff, which I've never actually known about until I started school. So that's been really fun.
Well, good. Yeah, I was just telling them while you were talking to the veterinarian that we're lucky here in Arizona that we have such a wide scope of practice, and our program includes acupuncture and all of that. Well, good. So the last part of the question I have, and then we'll open it up to the rest of the attendees. What are, say, 2 or 3 things that students need to be successful in this program?
I would say you definitely need to be motivated to be in this program because unfortunately I've seen a few of my classmates drop just because it's a big workload. I mean, it is medical school and you need to know why you're here and why you want to finish. And it is kind of like I've had this conversation with my school friends a lot because a lot of like our outside of school friends or our partners are like having full-time careers and they're making money and we're still just studying in school. So it's a little annoying, but you have to always remember why you're doing it and why you want to finish the 4 or 5 year program that you're in here for. And you also need to make time for yourself. So school is like most of your life, but also have hobbies, go travel around when you have free time on the weekends, make friends and go out and do fun stuff.
Right. I mean, you know, it's always like you have to take care of yourself first before you can take care of anyone else, right? And that's why on our campus, you know, we have a yoga center, we have a fitness center, an herb garden. You know, we try to have these resources for students to encourage them to take time for themselves and take care of themselves while they're in this program. Well, good. Well, let's see here if there are any questions for you.
I see there is one. From Jennifer?
Yeah, feel free to answer that, or I'll just read it aloud. Hi, Christiana. I'm interested to know, what does a typical school day look like for you? How much homework do you have compared to what you had in college? And how many hours a day would you say you work on homework?
So I think that really depends on the quarter that you're in. So there are certain quarters that are tougher than others. And I would say the first year, well, it depends on, I always say that it depends on your background. So if you are a science like if you're undergraduate degrees in science, I think you're better off your first year because it's a lot of like basic sciences versus the people who come in here with not a lot of science background struggle a little bit more, I think. So I think the first couple quarters were okay because it was a lot of like science review from undergraduate. You still need to study a lot. Also depends on which professor you have and how they structure their exams. Some people are very difficult, while others are very like more chill. They just want you to like know that you're paying attention in class, that kind of stuff. So I would say quarter 7 and quarter 8, that was my hardest one yet, because there are a lot of expectations for you. You're preparing for clinic, you're studying for the NCLEX exam. You have other like mandatory exams like clinical entry exam that you have to study for. Overall, I wouldn't say I study every day because I'm the type of like, once you get into the school, you will realize what works better for you. So I don't think I had the same schedule as I did in college because I realized I need to study in a different way to be better at this school. So where was I going with that? I like to study more throughout the week. Like I'm a morning person, so I'll start studying at like as soon as I wake up at like 5 or 6 a.m. and then I'll finish by like 2, 3. So then I have the entire afternoon to do whatever I want. I know other people are like more night people, so they like to study later in the afternoon. So you have to find what works for you. And then I only set up to study 5 days a week so that I have my weekends to hang out with friends and do whatever I want. So I hope that kind of answered that question.
Yeah, great, thank you. And I do see that there are a couple questions in the chat about like the prerequisites and the application process and all of that. So Deborah and I will answer those questions at the end. But for now, I want to focus on questions for Christiana. So here's another one. In studying nutrition, what is your course load at SCNM with that focus? I realize there are dual degree programs under naturopathy. Are you partaking in any to enhance your nutrition focus?
So I'm not, like there are the required courses that you need to take under the didactic program to be an ND. So you think, I'm not sure, there are maybe like 4 or 5 nutrition classes that you mandatorily have to take with Dr. Kennedy. And then there are some nutrition selectives that you have to take, I think 12 credits of selectives to graduate. So I've taken, I think 2 nutrition selectives that you can choose to take, but all of the other like masters of nutrition programs, I'm not deciding to do those. I mean, as of now, I don't know what the future holds, but I think I have enough of a nutrition background now to be able to support my patients well in the future. Because I focused so much on nutrition when I was younger, like in college, I think there's a lot more to learn now, like the acupuncture, botanical medicine stuff, which I think is just as equally important when you're treating patients as an ND. So I want to focus more on that part now instead of nutrition.
Yeah, and my understanding was that students in the ND program take almost 100 hours in nutrition, and that's one of the major modalities that we teach. I think botanical medicine is closer to 120, something like that. Acupuncture, Chinese medicine is even more. But yes, definitely nutrition is a big part of it. And just as a little side note, we even have a teaching kitchen on campus. So sometimes the professor, the instructor will bring students in there and do like a cooking demo and have students get into groups and have a cooking contest and things like that. So that's great. And so, Christiana, the second part to that question was, what are your after graduation plans once you have your degree? I also have a focus on nutrition, so I'm very interested to have an idea what the path looks like in an ND program.
I think my plans after graduation, I honestly haven't decided whether I want to do a residency or not. I think that's more of a quarter 15 kind of decision, whether you want to apply for that or not. I definitely want to open my own business right out of school, which I'm already saving up money for. So as long as I pass NCLEX 2, I will be doing that so that I can treat my patients probably virtually, or I'll like rent out a room and see patients that way. I do plan on maybe going to get the certified nutrition specialist extra certification, just so I have more of a focus on nutrition. But like I said in my previous question, as I joined this program, I've learned that nutrition, although it is like a major way to treat patients, there's also so many other different modalities that I also want to learn and incorporate into my future practice. So there's a lot to learn.
Great. And so we have another question here. What would you say are the biggest challenges in school that you would tell a prospective student that maybe you didn't know until you were in school?
The biggest challenge, I think, is just the motivation, because there have been a few times that I and my friends as well are just like, why are we doing this? I don't want to do this anymore, because it does get really challenging, and you won't, I mean, maybe you're a great student, but it'll be very, very hard to get all A's and pass every single exam, and it gets really overwhelming at certain times. And then if you were like a straight A student, like I was in college, it gets like very, you get like very annoyed when you can't do as well as you did in college. I have a bet right now here, so
Okay.
I will pause and then come back in a second.
Okay, that's fine, not a problem.
Thank you.
Mhm. Okay, so let's see. Okay, I'm going to go back up to the question about the prerequisites. Let me find that. So what exactly are the science courses required to apply? Is this information on the website? Yes, it is on the website. So 12 semester credits in biology, these are at the 200 level. So this would be like anatomy, physiology, genetics, microbiology. Those are just a few examples. For chemistry, we do require organic chemistry and biochemistry. So those are the science courses. But again, please do feel free to email us your transcripts so we can see what you've already taken and then let you know exactly what additional courses that you'll need. And I see there was another question here. Hi, would you be able to discuss the application process, including the timeline and deadlines for applying? So we actually accept applications on a rolling basis. So there's no hard deadline. You know, right now we're still accepting applications for this fall, which starts in early October, as well as next spring, which starts in early April. So you are able to apply to the program a year prior to when you're ready to start. So say you're thinking about applying for next fall, so that would be fall of 2023. Then you can apply this fall in fall of 2022. And if you were to interview with us and be accepted, it would be under the assumption that you would complete your degree, complete your prerequisites before you start our program. But you would just apply through the website. You would be required to submit 3 letters of recommendation. One would be from a healthcare professional, like it could be a conventional medical doctor, an ND, a DO, a nurse, a chiropractor, so many different options there. One would be from an academic professional, like say a college professor. And the third would be from a work or volunteer experience, like maybe a colleague or a supervisor or a manager. So those 3 letters of recommendation. You'd also be asked to submit a personal essay, a 1-page essay on why you want to do this. And you'd be given kind of prompts and questions to ask to help guide you. You would submit the application, and once it's submitted, either Jody or Jane, our colleagues, would look over it. If everything looks good, they'd invite you for an interview, which right now they're being held via Zoom a couple Fridays a month. So you would interview with us on a Friday, and then you would know by the following Tuesday if you've been accepted. So that's how that works. Let's see here. Deb, do you see any other questions that we can answer right now?
I don't, but I wanted to add to that application process. For those of you who are thinking of applying for fall of 2022, as Sarah mentioned, we are offering an application fee waiver code. It will save you the $115 application fee. I'll put Sarah's email in the chat again, because to receive the code, all you have to do is send in a copy of your unofficial transcript, and Sarah will email back the code for you and save you $115. So that's a pretty good deal.
Thank you, Deb, for mentioning that. So yes, please feel free to email me your transcripts or any other questions. Let's see here. I'm just looking for some questions that I can answer. Okay, someone asked, what is housing like for ND students? So we're a pretty small campus, so there's no on-campus housing, but there are apartments and condos right on either side of campus. So some students live there right within walking distance. But we're in Tempe, which is a college town, lots of apartments, rental homes nearby. But I see Christiana is back. So everything okay?
Yes.
Okay, that's good. Let's see, so did you, I think you finished answering the question about the biggest challenges. Is that right? Was that the last question we were on?
I believe so, yes.
Okay. We can answer the scholarship question later and the tour question later. Maybe you can help answer this. I'm considering a career change. Do you have non-traditional students in your cohort? If yes, what is their career track after graduation? Did you hear their feedback on success, regrets? Well, do you know of any of your classmates who are kind of a more non-traditional student?
I do actually have several that are in their 40s. One of the women in my cohort is, I think, 60. And a few of them have children, so they're older and they have like families of their own to take care of. And they all love it. I actually shadowed a doctor yesterday who went to SCNM, and she went to school when she was 45 because she did counseling before that for her whole life, and she does not regret the decision of becoming a doctor at all. She loves her job right now. And I know my classmates as well. Some of them were massage therapists. Another one is also a counselor, therapist. And they all just want more control over how to treat their patients. So I don't think anyone regrets changing careers.
Yeah, I mean, we hear that all the time. I mean, the average age of our students is about 31. So we also have students in their 30s, 40s, 50s, you know, who've had a different career, different life experiences. So it's quite common. Okay, very good. Let's talk about this. Hello, what has the environment been like at SCNM since the pandemic, and how has it changed? Are some classes offered virtually, or is it mandatory to attend in person? Are students back in person and on campus?
So I think, if you want to correct me if I'm wrong, that depends on the professor of now, because some of my classes are virtual and some of them are in person. Clinic is all in person right now. And so for the regular classes, I believe like all labs are in person right now. And then for other classes, depends on the professor whether they want to do Zoom sessions or have everything in person. But then, yeah, if you have like an excused absence or anything, you can zoom into the class.
Right, that's right. It's kind of a hybrid option, though more and more of the classes are becoming in person after, you know, much of the past couple of years. A lot of it was virtual. I think about 60% of the lecture classes are in person right now, as well as you mentioned, of course, the clinic rotations and the labs. So yes, definitely working back towards that in person. I mean, Christiana, you must be able to notice a difference with more students on campus. You know, it must feel good.
It has been a lot better. Yeah, it's been a lot better recently because it's a lot more fun now, because when COVID first happened, everything was online and it was pretty slow and empty at the campus, but it's a lot nicer now.
Good. Yeah, I was there the other day because I'm there a couple days a week, and I saw the students in the herb garden having lunch and talking and laughing. So that was good to see. So I see we have a question that was sent to me privately. I was going to answer it, but you might be able to speak to this as well. Are there any programs or resources that the school provides regarding mental health or stress reduction? I don't know if you want to talk about the mind-body psychology modality and the resources we have, like the counselor for students if they need it.
Yeah, so we offer free counseling sessions. I believe it's 4 or 5 sessions you get for free as a student. You have 2 free visits per year as a student to the clinic. So a lot of the doctors do a lot of mind body sessions. They would have to be student visits, but the students really love doing that kind of work too. So we also have a lot of help from the staff and faculty who work at the school. So if you have any questions or concerns about stress relief or anything, there are a lot of resources to go to and people to help you with that. And also I've noticed that classmates all help each other as well, because we're all going through the same stuff. We all have these same fears and stressors. So everyone here is a really nice community to help each other out.
Yeah, and I just want to say on that note, because although we are starting to have more programs, like we have an online master's in clinical nutrition, all the students who are on campus in person taking classes, they're all in the ND program, the naturopathic medicine program. So they're all on the same path, and there really is that sense of community there. It's really visible. So let's see, here's a question. How are you financially secure during your program? I was wondering what work study jobs were offered and what students typically partake in while in school to assist with finances.
So I am fortunate enough to have my mom pay for my rent, so I don't have to worry about that aspect. I do take out loans though to pay for everything, to pay for school tuition and all my outside activities. I do have a federal work study job at the IV suite in the clinic. So I've been doing that for about 1.5 years. You learn how to make the IV bags that you give to patients and how to do IM injections and vaccines. And so you kind of do all the behind the scenes work in the IV suite, which I really love because you don't learn much of that as a student. You learn more of like the actual hands-on process. So that's been a really, really fun federal work study job that I recommend everyone to do, because you learn a lot and you're very hands-on. There's also a lot of other jobs. Oh, what's another one? I work for the, what is it? Offsite administrator. So I do it's remote, so I can do it like on the weekends or whatever I want, but it's really nice because it's kind of just like emailing and calling NDs around the valley for when you're in your 4th quarter or your 8th quarter, you have to do field observations with another doctor. So you kind of just like call and communicate with other doctors and see whether they're interested in having students from the school shadow them for 8 weeks or so. And I also do student admissions, which is not a federal work study job, but it's like a side job. And I always recommend going with all the school jobs because they work with your class schedule, versus if you get a job like outside of the school, it's a lot harder to maintain that.
Great, yeah, thank you for that. And yeah, we have a great financial aid department. Most of our students take out loans, which covers the cost of tuition and living expenses as well. You know, we have a great financial aid department. If you have any questions for them, just feel free to email us. I don't know, Deb, if you want to put Claudia's email address in the chat in case there are any questions about financial aid. We do have some small scholarships as well. And so I have a question here. When or what quarter do ND students start seeing patients in person? So I know, Christiana, you're a quarter 9, so you just recently started clinic rotations, is that right?
Yes, I did, yes.
So yeah, if you can just tell us a little bit about that and what that aspect of the program is like.
Yeah, so I just started clinic 4 weeks ago. When you're in your 8th quarter, about to start clinic, you get to pick, or you get to choose kind of like what attendings you would like to work under. So it's like a process of emailing the attending, asking to be on their like list of students they would like to have on their shift. And so it really depends on which attending you'd like to shadow or work with, because each one of them treats the students differently and has lesser or higher expectations. You'll learn that as you go through the program. But basically, some of the attendings I'm just a secondary, which means that I kind of just like go in with the patient take their vitals, and just sit and listen to the entire interview process as the primary student does mostly everything, like the interview, the physical exam, and all that kind of stuff. Other attendings want you to be a primary right away. So they want you to do the entire interview process, take physical exam findings and all of that. So depending on who your attending is, it's necessary to be very prepared because they expect a lot of you. But regardless, everyone is there to help you, and it's pretty scary your first week, but it turns out to be okay because all the students who are above you, like older than you, I guess, are there to help you. So they answer all your questions.
Well, good. Well, yeah, thank you for sharing that. And so we have about 10 more minutes left in this chat. So I'm going to ask you another 1 or 2 questions, Christiana, and then in the remaining time, Deborah and I can answer any remaining questions about the program or the admissions process. So let's see, I just saw it. Where was it? So this person is saying that they're a career changer, and they were wondering about the dynamic, the student culture and the dynamic in the program. You know, we talked earlier about, you know, kind of the sense of community. I know there's lots of different clubs to get involved in, things like that. So can you talk a little bit more about the culture and dynamic?
Yeah, so I think it's really, I mean, it's kind of like college, undergrad, it's what you make of it. So if you want to be really involved, you can be. There are so many clubs and activities to join. You can join to be part of the board, like student government has like 10 people on the board and they meet pretty often, I hear. There's also like small clubs, which I was part of the nutrition club. So we met pretty often and we chatted and we like made activities for each other to do all the time. So we saw each other maybe once a month. Yeah, there's so many things to do on campus, and as Q1s, you like learn, I mean, you'll all know each other and you'll meet each other and you'll find like who's in your little niche, like who you want to become friends with. And there's always like study clubs to join to, and you'll just spend so much time on campus because the first quarter your classes are like 9 to 4 basically. So you'll be with your classmates all the time. And yeah, but then again, if you don't, like if you have a family, like a lot of the classmates that have families, they choose to just do their own thing and just come to class. And yeah, it's really what you make it. So you can do anything.
Mm-hmm. Well, good. Let's see here. And so one last question before we let you go. What is one of your favorite memories, experiences related to SCNM?
I really love the labs because, like I said, I didn't know much about acupuncture or phys med, any of that kind of stuff before I started this program. And I think the acupuncture lab has been my favorite so far because all of us just kind of hang out with each other in the lab. Of course, it's supervised, but we're just like sticking each other, and it's a lot of fun just to play around basically and learn at the same time. The phys med lab, mine was online, unfortunately, but I hear that it's opening up again. So I've heard from prior classmates who have graduated now, but that's also been a really fun lab to do as well.
Well, good. And speaking of labs, I mean, we also have the research labs and our new Botanical Research Institute on campus. And there was a question that just popped up about research opportunities. Are you involved in that at all?
I was for a quarter, but I realized research is not my thing. But there is a lot of research. So Dr. Langland is like one of the main researchers on our campus, and he's going to teach you research, I think your first and second quarters. And then he also teaches immunology and microbiology, I believe. So he's like your main guy to go to if you want to do research. He gives a lot of volunteering opportunities. And I think you can also do it for selective credit. But yeah, you can just reach out to him as a Q1 and he will give you something to do.
Yes, yeah, and I can go into that in a little bit more as well.
Mm-hmm.
But yeah, so Adriana, I want to let you go. Thank you so much for joining us. I know it's been a stressful afternoon for you. And
yeah, I'm so sorry this didn't work out as planned. But if you want to put my email in the chat, so if any of the students want to email me anything, go ahead.
Yes, Deb, could you do that for us?
Absolutely.
Yeah, because it would be A dot and then your last name Engelhardt.
Oh no, it's K. Sorry, Christiana.
Okay,
K.
that's
dot
right.
Engelhardt. Yeah, at SCNM.edu.
Okay.
Okay.
Perfect. Well, yeah, thank you again. And I hope everything goes okay with your little fur
Thank
baby.
you so
And thank you
much.
so much.
Thanks.
Okay.
Bye.
Bye-bye. Okay, so thanks everyone for hanging on. I did see there's a few more questions here, and Deb and I are happy to stay on and answer those related to the program or the application process and all of that. Let me just backtrack a little bit and see what I missed. So there is, let's see here.
There was one on campus tours, right?
Oh yes, there was one on campus tour. So yes, it is possible to visit the school in person now to take a tour. We offer campus tours every weekday at noon, although we do prefer that you schedule it in advance so we can know to expect you. The tour will be done typically with a student ambassador, one of our current students. And also we do like to have your unofficial transcripts prior to scheduling the tour as well. So yeah. So feel free to email us and let us know if you'd like to come for a tour at some point. We'll tour the different, oh, yes, was there a question?
Yes, I'm sorry. I wanted to know, I was thinking about taking my prerequisites this summer. I mean, I only have one prerequisite left to do. And I was wondering if I didn't take it this summer, because actually I used up all of my financial aid. I know that's hard to do, but I did. And and I was thinking about taking it this summer before I possibly, if I got accepted, could I take the biology, I mean, not microbiology, biochemistry the summer before I come, or would I have to have that completed before I even got accepted?
No, you don't have to have it completed before you get accepted. You can take it, you know, as or after you apply to the program, but it just needs to be completed and you need to have passed the class before you start our program. So if you're wanting to start our program in the fall, but you take that class in the summer, then that's fine, the summer before.
All right, thank you.
Yeah, not a problem. Okay. Deb, do you see any other questions I missed? I know there were
scholarships. I saw one about scholarship opportunities as well.
Yeah, so we do offer some small scholarships. Usually there are several throughout the year that are offered. So once you've gone through our application process and interview process and been accepted into the program, you're welcome to apply for scholarships. Usually you're encouraged to write like a short, one page or a couple paragraphs about whatever the question is related to the scholarship or why you want the scholarship. But yeah, and you can certainly work with our financial aid department through that process. Let's see here.
They asked about deadlines for the scholarships as well.
So deadlines, I think, do those coincide with the like a couple months before the classes start? Deb, do you have more information on that?
I know that the one larger scholarship that we offer, it's a $10,000 scholarship. It's merit-based. That one, there is a date. And so obviously the earlier you apply, the better. And that's why we open up the application a full year, because that would be a very helpful scholarship to receive and you wouldn't want to miss the deadline, but the deadline's different every single intake. So the deadline for fall of 2022 would be one date and it's already passed. It's long past. And then there'll be a new date for spring of 2023. I am sorry, I do not know the date, but I did put in the chat the email address of Claudia Rangel, our financial aid advisor. And so it's based on her name. So, it's the letter C dot RANGEL @scnm.edu. You might have to scroll up to find it, or I could put it in there again if you'd like me to. But Sarah and I are not really experts on the financial aid, so we really want you to connect with Claudia for any of those more detailed questions.
Yes, okay, thanks, Deb, for that clarification. I appreciate that. I see we have a question here. If we have been to multiple schools, would all the transcripts be necessary for the waiver? So yes, if you've attended, say, community college and university, or a couple different universities, then yes, please email us all your transcripts for that pre-evaluation, so we have a good idea of what you've already taken and let you know exactly what you'll need. And then, of course, once you apply, you'll need to submit all your official transcripts from every college you've attended as well. So yes, and for the waiver, yes, if you email us your transcripts, we'll get that taken care of for you. And if you're ready to apply soon, we'll email you the application fee waiver. And I do see another question here about the COVID vaccine. So do you accept students who are not vaccinated for COVID-19? So as of right now, our policy is that, yes, we do require the vaccine, but you are welcome to apply for a medical or religious exemption. So that's where it stands now. I don't know what it's going to be like years from now, but that's where we are right now. And let's see here.
And we can email those exemption forms to you if you'd like us to, or you can up in the search engine at scnm.edu, up at the top right, there's a search engine. And if you type in vaccine policy or consumer information, you'll have to scroll and scroll and scroll. I do apologize, it's a long page, but you'll come to an area that has the vaccination policy. And so it's a large explanation. And so I do recommend that you do read that. But of course, we do have the medical and the religious exemption. And if you just wanted to email Sarah, I think you have those forms. If not, I do. And so we can just shoot you the forms, and that's easy to do so that you have those.
Yeah, thank you for that. Yeah, definitely. We'd be happy to email you those forms so that you have more information about what's involved. Definitely. So I see a question here. I see we are just a minute over. So I will answer one more question here, but if you need to go, feel free. And again, thank you all so much for joining us. I see, does the school help with job placement or internships? So although we don't have a job placement program per se, we do have a career services manager that can help you every step of the way throughout your program. She can help you write a business plan. She can help you apply for a residency if that's something you're interested in. She can provide you with networking opportunities. And, you know, this is varied year to year, you know, maybe during the past couple of years with COVID, I'm not sure exactly what the statistics are, but I know there have been past years where, like, you know, 80% of our students had a job lined up before they even graduate. So that's due in part to the services we offer, but also it's up to the student to really, you know, put yourself out there and try to make those connections with naturopathic doctors, because most of our students, once they graduate and pass board examinations, they join an established clinic working with other NDs and other health professionals. So definitely opportunities in that regard. So if I wasn't able to get to all of the questions, I know Deborah did put my email address in the chat. And then she just also wrote the career services manager's email address if you want to email her with any questions. So yeah, thank you all so much for joining us. Again, if you also have any other questions, you can also email admissions@scnm.edu.
And I have a commercial for the next virtual chat. Will be with Dr. Tara Payman. She started her own naturopathic mental health clinic after graduating from SCNM. She's now hired 3 or 4 additional SCNM graduates. Her focus is anxiety, depression, and bipolar. But one of her colleagues that she has hired has their focus in schizophrenia, and yet another one in psychosis. And she's going to do an amazing presentation on mind-body medicine and what it's like to have a focus of helping to heal people naturopathically at her naturopathic medical clinic, mental health clinic. And that'll be May 11th at 2 p.m. Arizona time. So I'm not sure what time zones you're in, but you'll be getting an email reminding you about this upcoming one in May as well, which is Mental Health Month. So it's appropriate.
Great, thanks, Deb. Yeah, that'll be really interesting. So yeah, hopefully you can join us next time and have a wonderful day. Thanks.
Thanks, everybody.
Bye-bye.